Barbara, welcome. I'm very happy to have the presentation today about a very interesting topic, EMDR. And before we get into the topic, could you introduce yourself and tell a little bit about your background and what you do?
Well, I always say I'm a therapist, but the truth is I'm also a psychologist, which is not always the same, but I practically do mainly therapy because psychologists can also do testing and stuff like that. But my passion is therapy, so I do just psychotherapy. And here in my life, I have spent quite a lot of time working with international crowd, with expats, and so I also have an international husband, so that area is very close to me. And I have been also involved fair bit in a work with trauma. I have worked with an American association that kind of works with trauma, so that's one of my interests. But I also work with couples because I always
couple
therapy. So I have always found it fascinating. So this is what I do too.
Excellent. And I have known your name for at least 16 years. This is the time I'm in Prague. So you have a long experience in Prague as a therapist.
And I have been around for a long time too. Yes,
right.
Yes, that's
okay,
true.
Excellent. So today we are talking about a very interesting topic, which not many people are familiar, which I have come across in the US in the past, but we will dive into it, what it is, and it's called EMDR. And can you explain what is EMDR?
Absolutely. And you are right. I first heard about it from my friend who lives in USA. And so it is quite new in the Czech Republic, but I have known it for some time. And it's a special method that was developed for treating PTSD, which stands for post-traumatic stress disorder, which might people associate a lot with war veterans, for example.
That's where I heard it and read about it.
Exactly. And so it was developed for treating trauma, but as the method was used more and more, it was discovered that it helps with many issues, not just big traumas, but we all suffer certain hurts, injuries that influence how we react to things. So nowadays it has quite a wide use.
So that's very interesting. So it's not only for people who are really traumatized in the sense that real trauma. It can also be applied for many different other contexts and backgrounds.
Exactly, and that's what sometimes puts people off because they think, I don't have a major trauma, it's not for me. But you know, for example, I quite often come across people who have had terrible experiences at PE, that means like physical education at school.
That's me, for example.
Yeah, I think there is many of us. So. And people like are influenced by it. Let's say they hold back.
The self-confidence goes down.
Exactly. And it has a lot of things to connect it to it. And we wouldn't call it trauma with big T, but it still influences our life.
Yes, of course.
So I have treated a lot of people and their experiences going through physical education and helping them with being more confident and then going into sports and starting to love movement again. So it's
very interesting.
Yeah.
So the original tell us about the original background of the of how it was invented, where it's coming from, and.
So it was quite interesting because it was kind of discovered by this Frances Shapiro, who was a lady who discovered that when she walks, her anxiety kind of drops down. And she started to notice that there is something about like kind of these, or if she walks or if she, let's say, goes on a train and her eyes do a certain movement, somehow she started to think differently about stuff. And she started to observe it more and more, and then she developed it into a method. And at first there was not very clear how it works, but now that there was a lot of research done because she also had to kind of sell it then to clients and insurance companies. So now there is quite a lot of evidence that it works.
So it is evidence-based? There's studies and there's evidence?
Absolutely. And as you mentioned, the war veterans, that was at the beginning, they were interested in it very much because it it seemed that it's really one of the few things that treats trauma very well.
Because it's very difficult to treat trauma in these settings of veterans and war.
Because what the problem is, what kind of PTSD teaches us, that these dramatic experiences, they really get imprinted in our nervous system. And the same happens with very repeated experiences that we have as children. You know, it kind of, we start to react in a certain way. Our nervous system reacts automatically, and that's influenced by how memories are stored in our brain. And somehow they discovered that, now they know, they have some theories on why, but that EMDR changes the way memories are stored. And so this was the beginning, and then it became clear that it's not just through eye movement, because the abbreviation calls for eye movement desensitization and reprocessing, which sounds terribly scary, and some people are aware that it has something to do with eye movement. But later they discovered that it's mainly about engaging the brain, so it needs to switch from one hemisphere to the other. And so you can do it either through eye movement from side to side, or from like stimulation, which kind of touches left and right foot or left and right hand.
Like the tapping, for example?
Exactly. Tapping. And there is even a machine nowadays that can do it for you, and that we might.
Which we're going to show later. Which is approaching all senses, the eyes, the ears, and the touching or the tapping.
Yes.
So this we will look at later, because it's very interesting to see it also in practice and how it looks.
But needless to say, also it's possible to do it without machine. The machine is just comfortable and offers more variety. But many therapists just do it with their hands.
I have seen it in a film where the therapist does it, and I've also seen it in a film where the machine is used. So actually, it's I think this is very interesting for our clients.
Yes.
So is it? I guess some people will have a fear that they're losing control, like in hypnosis, or there will be a loss of consciousness or something like that. Is this something which is justified, or can one be quite relaxed about it?
Yeah, it's understandable, because it feels quite weird, like somebody doing this or tapping, so I can understand it. But actually, client stays in control whole time aware of everything. It has nothing to do with, let's say, people have a feeling that it will be something like a trance or a hypnosis. Absolutely not.
So you're in control, you are present, you're not...
You are really controlling it. Sometimes what can come are strong emotions, but we can feel it's coming, and a therapist monitors all the way. Sometimes the emotions, because sometimes when some difficult memory comes, we can get emotional, and so it's, for example, good to, when I have a EMDR therapy session, not to go straight to work after that, because emotions may come, and this might
maybe also not drive, or maybe take it easy for the rest of the day. Yes,
exactly.
Okay.
Let it settle. So it can be emotional. That's true. People often feel exhausted after it, because the brain is doing a lot.
Which can be also for talk therapy, no? You can also feel emotional and exhausted afterwards.
That's true, but I have to admit that EMDR takes it to another level. Yes.
Okay.
But sometimes people are afraid it will be too overwhelming. There are some techniques that also kind of pace how intensive it will be. So when we know that somebody is bringing a really traumatic content, we work with it, we go gently, so you can really control the whole process very well.
And does the patient or client need to describe the whole traumatic experience in detail, or is it can they stay on the superficial level, or what is the best practice, and how does it work in
Yes, that's a very good question, because many people, especially when they have some...
They don't want to go there, no? They
Exactly.
want to like relive it.
Exactly. They don't want to relive it, and they also don't want to like say explicitly what happened, especially when you have a sexual trauma.
Yes,
people don't
or
want...
childhood abuse trauma.
Exactly.
Maybe there's a shame issue.
Yes,
And
yes. And that's advantage that you don't have to describe the therapist the story. Yeah.
Okay.
Because it works like, if we simplify it, it's practically thinking of a traumatic memory. The therapist might ask, what is your body doing as you are thinking about it?
What do you feel?
Yes.
Do you start like sweaty hand or something like that?
Yeah, so the awareness, like be aware of what's happening, the therapist might ask about it, but the therapist doesn't need to know the story. So then the whole process works even if we like don't talk about the content. We just kind of observe what is the body doing. The client can say, I see images of the accident, and that's enough. It's still doing the job.
Okay. And is it like that I come with my traumatic experience, I have one session and it's gone, it's healed, or does it need a series of sessions where it gets gradually better, or how does it work in...
Yeah, it's very close to what you are describing. So it depends on the difficulties that we are bringing. If there is one single trauma, like let's say you have been through a car accident, it can have effect very quickly, even let's say 3 sessions. Yeah. If it's something that was very repeated, and that means that it's very fortified, very conditioned in our nervous system,
then you need to like condition it more and repeat and
yes. And that may be something that would interest our clients, because we have talked a lot about trauma, but many people use EMDR for changing certain patterns which they are unhappy with. Let's say, you always get very anxious and stiff when you should go and fight with your partner. Yeah, many people fight with that. They are like, oh, I want to say something, but I get very frozen. And then, the relationship suffers because they never discuss issues, and they say, I see it with myself over and over, and I can't change it. And this is where...
So you break the pattern, you get unstuck, so to say.
Exactly. We are kind of looking at where was that pattern created. If I simplify it, let's say it was because I had a very authoritative father and
dominant at home, and yes,
and I could never speak up, and it got stuck in me that I mustn't.
And this could be in work now coming through, that you're not like able to speak up to your boss, to your colleagues and so on, or as you say, in relationships,
or in very often
couples. That's very interesting.
You don't give right boundaries because you always so it usually this influences us on many levels. So and then we look for where maybe that pattern was created, and we approach it with EMDR to kind of dissolve the pattern, build new pathways, and then we kind of actually start to really feel that now I am an adult and I have totally different options than when I was 5.
So that means this can be a standalone treatment. Someone is coming to you with an actual trauma, or as I hear, you can also integrate this, for example, into couples therapies, that at one stage you see that there is a pattern which holds one partner back or both partners back, and then in your daily work you incorporate this as one tool or as one useful approach.
Yes.
Is that how it's...
That's how it's used. And I often, like, for example, when somebody comes just for a talk therapy, and I still suggest, I will say, like, look, it seems like this pattern keeps reappearing. Maybe we could look at it with this method, and then we do it.
That's a very innovative approach, I think, to combine it.
Well, it's done because when you know that there is a potential to change pattern faster, why not use it? Yes.
That's absolutely. And are there any common myths or like fears or
what people are afraid of?
Or what people think this is some new age?
Yes. Sometimes it feels a bit shamanistic, like tapping or doing this. So this is why people think it's this trance. Yeah, there has been lots of methods using brain scanning, and so it has been shown that after treatment with EMDR,
you calm down.
Yes, and some parts of the brain that are responsible for kind of danger response, they get less active. So they still don't know this kind of switching between hemispheres, how exactly it works. There is one theory that probably it's a similar process like we go through in sleep, where
like the REM sleep and the regeneration of the synchronization of the brain's hemispheres, and
it helps us to kind of process emotions and kind of store memories. So that's a similar process with EMDR, but also there is a strong possibility that it involves working memory, that when we think about something difficult, as well as kind of paying attention to this bilateral stimulation, the brain starts to create new pathways to content which was kind of frozen and stuck there. And this is what kind of enhances the neuroplasticity.
Very interesting. And I think you described it very nicely about the evidence before, and when people think about it like a shamanic, little bit new age therapy, that we can actually point to very robust studies in the US of the Veterans Association, which run their own hospitals, and they're very high on evidence, and they have really a lot of, I looked at it myself, a lot of interesting studies and very well done studies where they show how well it works on war veterans, and therefore it is logical that it also can do a lot of good if you don't have the huge trauma, but you are somehow traumatized either on a small level or on a perceived level in your life.
And as you know, we all know that going through life, we have experienced rejection or hurts, losses, all of us. So
and some people also say this is the purpose of life, to go through challenges and so on. But of course, sometimes it overwhelms you, and then there could be a tool of helping people to get stronger and not
absolutely. And also, even in EMDR, they use this term trauma with big T and trauma with small t, you know, because people are sometimes hesitant to say, the divorce of my parents was a trauma with big T. It is a difficult experience, which usually leaves some scars and challenges. So, EMDR counts on that.
Okay. And can one say that there is a list of diagnoses where it helps especially well, like anxiety, depression? Is there like a list of indication from a medical point of view or from a psychological point of view?
Look, with diagnosis, it's a bit challenging because we always look some diagnoses like depression. Some depression you will clearly trace when it started and how, and that it was following certain event. And then I would say EMDR can be a great help. Of course, then there are also depressions which have a strong physiological component when it's a bit hereditary, and so this is what you have to look first. So maybe more than like which diagnosis is it especially helpful, it's more like, if our life experiences have a major play in the diagnosis, then it can help with almost anything.
Okay. Excellent. It's and I liked very much your example about walking through nature. What you said before, that this could be a related reason why we feel recharged after going, because then our eyes they spread. We don't have this tunnel vision anymore after a stressful day. You walk to the nature, you look at the bird, you look at the tree, and this
and
can
you also, as you walk, it's a natural bilateral stimulation, because you right foot, left foot, right foot, left foot. So it helps processing.
Maybe even especially if you do it mindfully.
Yes. And to be honest, we could maybe say at the end that there is even a way how to self-administer it. And Shapiro herself has a book which helps people to kind of do small exercises at home to help them to process certain things. And there is even a way how to self-administer the EMDR method.
Very interesting. Barbara, that was really fascinating to learn so much more about EMDR, and it's great that we are working together and cooperating and are able to offer our patients this method under your guidance and as part of your therapy. And I very much also look forward to seeing how it works in practice and how the machine works. So thank you very much for doing this. And of course, if there's any questions or they can be always directed to us, and our team will be helping and guiding patients through the process to come to you. And thank you for your interesting.
My pleasure, Wolf.